We hope this will be a really useful session and provide a good opportunity to learn a bit more about the fund and to ask any specific questions that you might have. I think we've already covered this, but just in case anybody's coming in now, the session is being recorded. So please feel free to leave your video off if you'd prefer, and also everything that we talk about will be available for you to watch later and to recap on. And we're also very happy to send the slides round as well. So just some quick introductions. My name is Lydia. I am a grants officer at GiveBradford and I lead on this fund. Bill is also on the call, who's the Health Inequalities Lead at Modality, and Bill's role really is supporting some of you with your project proposals, and I'm sure he'll elaborate on that further. And then Michael is also here and he is facilitating the call. So just a quick overview. I'm going to really quickly talk a little bit about GiveBradford and what we do, and some of the sort of essential information about who can apply for an AWC health grant, and then Bill's going to talk in more detail about the specifics of the fund relating to the focus on social prescribing and health and wellbeing, and then we'll close up with a Q&A session. So if you do have any questions, please feel free to post them in the chat box throughout, or equally save them to the end, whatever you prefer. So GiveBradford is the partner organisation to Leeds Community Foundation, and we are a grant making organisation. So we give money to community groups and projects in Bradford to create positive change and to improve people's lives. Our funding goes towards lots of different projects that often improve health and build important skills and create social connection. And GiveBradford has given out 117 grants in the 21-22 financial year to support 87 Bradford organisations, and this number will continue to grow as we continue to build the resources available to the city and build our grant making. So our vision really is that Bradford will be a city of opportunity for all, and we're passionate about creating meaningful and positive impact for communities living in Bradford and the surrounding areas. And the AWC health grants will do this by improving access to essential health and wellbeing support in community settings that can more holistically address people's health and wellbeing needs. So I'll just talk a bit about who can apply. So this fund follows our standard eligibility criteria. So if you're familiar with that, it's not too different. But the full criteria is explained in the criteria document, which is on the website. And we always advise that you really carefully read this before starting an application. And then if you do have any questions, please do get in touch with us and we can help answer any queries about eligibility. But as standard, to apply, you need to be a community organisation and a not-for-profit structure with a governing document that explains the purpose of your organisation and how it is organised. And as part of your application, you need to upload this document so that we can read it. You also need to have a management committee, which might include trustees or directors, depending on your structure. And there needs to be a minimum of 3 independent people, so not related, not living with each other, and none of these people should have more than 50% control. And to apply, you also need to be able to show us evidence of good financial management and provide us your annual accounts, or if you're a smaller organisation and don't have formal accounts, your income and expenditure sheet. And then really importantly for this fund, to apply, you need to be delivering work that benefits people living within Airedale, Wharfedale and Craven, and you need to have a proposal that addresses the fund criteria, i.e. you're planning to implement an idea or deliver an activity that improves people's health and well-being, and that will form part of a local community health offer. And also, because of the nature of this funding, you will need to provide us with a copy of your safeguarding policy. So either for children and young people or for adults at risk, just depending on who you are working with as part of your proposal. So there are 2 levels of grant available, which will be explained a bit more in a bit, but just to note now that if you want to apply for a development grant, which is the larger one, then you need to have been running for 2 years and have a proven track record in the local area. And also to note that if you are already a recipient of a Keighley Community Health Grant, a 2-year development grant from the Keighley Community Health Grants, then you can't apply for another development grant this time, but you could apply for a Kickstart grant to build a new activity. We can only accept 1 application per organisation, and applications need to be completed online through our online application form, which we will send the links out for, but they're also on our website. And if you do have any difficulties with the application form or any queries, then please do contact us. So just a really quick bit about the reporting and evaluation for this fund. We ask grant holders to complete grant reporting just so that we can learn about what your grant has achieved and how the money was spent, and understand the impact that has been made to improve people's health and well-being. So again, there's lots more information on our website, but the forms ask simple questions about what you did with the grant, what you learned and how you supported people. And we often ask for a case study, which is just a little story maybe about somebody that you have supported and the difference that's been made to their lives. So as part of your proposal, it's a good idea to think about how learning will be evidenced and demonstrated, and you can include evaluation costs in your proposal budget. Just in terms of the actual reporting requirement, Kickstart grant holders will be asked to complete 1 end of grant report form after or at the end of the 1-year activity, and then development grant holders will be asked to complete 2 forms, which will be an interim form after 1 year of activity, just asking how things are going so far, and then a final end of grant report form after the 2 years, because it's 2 years of delivery. So that's everything from me. I'm going to hand over to Bill, who will talk a little bit more about the health focus of the fund. Thanks.
Hi everyone. Yeah, nice to see everyone today. I know quite a few of you, which is great. I'm Bill Graham. I work as like the Health and Equalities Lead at the Modality, which is a GP partnership across Airedale, Wharfedale and Craven. But my background is community work and running community projects. So I know what it's like to be sitting at the end of a call or an event like this where we're thinking about what grant we might be able to apply for and what projects we have that we might be able to get for funding. So, you know, I'm very aware of what you might be thinking at the moment. And I mean, there is a lot of process there that Lydia's just described, but it's not, you know, it's fairly straightforward, most of it. Quite a few of you will know about a grant application process. And I think for me, the Community Foundation way of working with the online grant application process is actually pretty simple. There's not too many questions. And, you know, in many ways, if we're working with people, we do know that we have to have certain policies and safeguards in place. So it quite often helps organisations think about the processes they have in place to work with people, which can only be a good thing in my view. Anyway, so the grants this is an evolution of the grants that we've run over the last 2 years, which are the Keighley Health Grants. And because they've been seen to be quite successful, you know, really good grants that have linked projects with patients and linked them into the local health system, we've managed to get a little bit of additional investment from the Bradford District Care Trust, and we've said we'll expand them over the wider area, which includes Wharfedale and Craven. So we've got a slightly bigger pot of cash, and we can expand the area, which is great news. Because for me, like Lord Victor Adebowale says here, communities have a vital role to play in the health of our people. And I think everybody on the call will know that today. And the voluntary sector can be a game changer in the way we maybe deliver that care, is what I would say, because you guys may well have some capacity to get involved in this at a time when in the health system capacity is a huge issue. So hopefully this is a way of getting organisations and communities, more involved in the health of their communities and the people that live there. Next slide, please, Mike. I mean, a lot of this feeds into the sort of the Marmot report that came out, where we talk about so much of our health is actually made up on what surrounds us and how we feel. Health isn't just physical. There's so many other factors that make us healthy, and a lot of it's to do with our connections, our friendships, how we feel about our lives and how we're getting on in our lives. Whether we're in employment, whether we have secure housing, all of these are key factors in how healthy somebody may be. And so, working with GPs, and looking at some of the data, we know that somewhere in the region of 30 to 40% of people coming into the GP surgery maybe have an issue that's not just a medical issue, but it might have some social factors behind it. So quite often the GP isn't really able to help that person with a prescription, a prescription as in a sort of a drug. But quite often the answer might lie in what happens in their community. So we've really worked hard in thinking about how this can be part of the offer in the general practice surgery, just purely because of the numbers of people coming forward who maybe don't have, their issue isn't a medical condition as such, it's probably more of a social issue. Next slide, please, Mike. And that really leads into why we have social prescribing. We also have health coaches and people who are linking people in with our communities. We've got just for anyone who's on the call who isn't overly aware of social prescribing, we're just going to play a quick, a short video just now, which maybe just explains a bit more what social prescribing is. So,
look, we all want to be healthy and happy. That's not an impossible idea, a lie, or a dream. And it may seem like quite an obvious thing to say, whilst we sit wondering whether society would allow us to say we were any other way. That pressure of appearance. Are we allowed to say when we're not okay? Because all too often, physical or mental health difficulties get in the way. Whether it's events beyond our control, personal circumstances, or genetics at play. Because if 1 in 5 GP appointments are for non-medical problems, then this could be a time to explore other possibilities and options. Like social prescription, a system that takes a different approach, where they won't just deal with the symptom, but sit with you to trace it, understand the cause, and then create a plan to replace it. Talking about your health, finances, housing, or stress, before linking you to activities that empower and suit you best. What if you were prescribed a social engagement, a social arrangement, to get a pep in your step and your feet on the pavement, a brush in your hand, a tune from your lungs, a talk and support to help you manage your funds? I'm talking about a place to feel connected with the community you've selected, making your activities more effective, experiencing as a collective so you are positively affected whilst feeling safe and protected. Surrounded by new people, allowing you to feel part of something bigger than you. We all want to be healthy and happy. And it's not just a nice idea, but a system that works, that asks if medicine isn't the only option and puts you first. With a wide range of solutions to help you get through, a social prescription could help you too.
Thanks. That was great. Thanks, everyone. Do we go back to the presentation, Mike? Yeah. So really, you know, as the video kind of explains, and I was saying earlier, you know, an awful lot of people coming into GP surgeries, it's not really a medical issue as such, and I think we all know people like that. We'll all know people like that we probably work with or are friends with already, and it's just really about giving people more options. And then the purpose of the fund is to, in many ways, I think as social prescribing started and social prescribers were saying to people, go to an activity or go to a group, quite often, and I was in this position myself running a community organisation, they didn't really come with much in the way of resource attached to them. You know, we were just expected to look after them. So in many ways, this fund is to try and help organisations feel as though that they're included in the process and they can have some resource for delivering the activity they want to deliver. The other key thing about working with our social prescribers is they'll make them aware of your projects and what you're running, and then you become part of the sort of the signposting. You know, the social prescribers locally will be aware of what's going on, and they'll be aware of your projects, and will be pretty confident that you're delivering good work and something that's a positive place for patients. And it's having that real menu of activity that goes on in a community as part of the offer. You know, whether it's I know Annie's on the call from Get Out More, you know, lots of activities outside in the wood, sort of forest craft type activities. You know, that's certainly, some people enjoy being outside. Some people like maybe more the one-to-one support, maybe some counselling or support available in the community quite quickly. And I know we've got Emma on from Missing Piece as well, who provide that sort of support too. So it's that real range of things that we have. And locally, we have a lot of social prescribers, and I'm not just talking as the modality GP practices, but it's the other GP practices in our area. They're part of a federation called WACA, and it's also there are other social prescribers who operate independently of that. I think there's Age UK personal support navigators that work around Airedale, Wharfedale and Craven as well. So the people who are working with patients then can hopefully be more aware and confident of the activities that are available locally. And you guys, as the providers of that activity, you're getting yourself on a pathway to getting resourced for some of this work, getting some payment towards the outcomes that you're creating for patients, which I think is really important. And as you're involved in that, you might think we could do more of this and start to think about how you might get on a more sustainable funding path. So the grant funding might be a stepping stone to more sustainable funding from the health system as well. So there's quite a lot going on here with the purpose of the grants and how we can build up the capacity in the voluntary and the community sector in Airedale, Wharfedale and Craven. Next slide, please, Mike. Yeah, as Lydia said, we've got two grant sizes. We have the Kickstart grants, which will be between £500 and £5,000 for a year. And really that's a chance for organisations to put forward an idea. You might not have worked closely in the health system before, you might not have had a health grant before, you might have an activity, you've got a good idea, but you want to test it, you want to see if it works, you want to see if people would come along and take part. That's very much the Kickstart grants idea. It's a place to get started and to start building that relationship with your local health partners, the social prescribers. And I would urge anyone who is thinking about, doing a grant for the first time, Kickstart grant might be the place to start. Because the hope would be, we're into year 3, after you've done a Kickstart grant and you've developed an idea and you've made some connections, then there's the opportunity to maybe think about a development grant. And then the development grants are there. A larger amount of cash you can apply for, between £5,000 and £15,000 a year, and you can apply for up to 2 years. So in effect, you can apply for £30,000, and that is then hopefully delivering a project or some work that's already got some evidence behind it and some some real good connection locally into the local health system. So that's the two types of grant that are available. And, like I say, once we've got people into development grants, we're trying to get people connected into local health systems so they can talk about their activities and look towards how we can support the projects that seem to be working very well on a more sustainable more sustainable level as well. So that's really important here, that there seems to be a pathway for the work that's getting done. Next one, Mike. Like I say, we're into the third year. We've had independent research done on the work in the projects and the grant funding that's gone out there, which has been really, really positive. Again, that's one of the reasons why we've expanded from just being Keighley Health Grants to Airedale, Wharfedale, Craven Health Grants. We are talking about, there's a lot of interest in the way we're working. Working with the Community Foundation makes everything really transparent. It's a really good open grants process. It's not a case of who you know or what you know. We have a really transparent process for applying to these grants. So it's it's open to all organisations to put an application in. We are talking about how we might expand this further across Bradford as well. Very much part of the shift, trying to shift some resources into community health and the community health work that goes on locally. So we're on a really good pathway here for hopefully creating more resource for community organisations in the local area. There's feedback there from some of the projects that have already been funded and from some of our social prescribers. Again, you're the guys on the call, you're the guys that are running projects across the district. You'll probably have some, feel some association with some of these comments. We're like an invisible army that's propping up a lot of people. That's quite often how I felt when I was running community projects in Leeds. And it's nice to be recognised with that as well. I think that, we've developed a great working partnership with our social prescriber, and his referrals have helped our service grow. Again, the social prescribers should be getting patients to you that fit what you do, and it should be mutually beneficial. It should help projects get the people they think they can help, and hopefully the patients that they get will feel healthier and feel better about their lives. So feedback's been really good on this so far, and I'm really looking forward to seeing how this develops in forthcoming years as well. So I think that's where we are, Mike. Yeah, are we on to and then we'll get the map. We've already had a few questions about the area of support. Airedale is Keighley up to Howarth. It's the Wharf Valley, and it runs along to sort of Steeton area, and then you're into the Wharfedale area, which includes Ilkley, Silsden and Addingham. So, I think there's definitely some people on the call from Silsden today. Make sure you get your applications in. And then Craven's a big old patch. Obviously, some of Craven is covered by North Yorkshire, and there's even bits of it are covered by, is it Morecambe Bay? But, we'll look at all projects in the Craven area. Ideally, we want them linking into patients that are patients and social prescribing projects that are based in the area. So Settle, we know, is a big area for local GP practices in Grassington. So yeah, that's the Craven area there as well. So, but we'll look at applications from all areas and treat them all on the same merit. And yeah, there we go. Any questions? Thanks, everyone.
Emma, go ahead.
So I've got a question, but I've got a comment as well. We've been in receipt of the funding for the last couple of years. We had the Kickstart grant the first year, and then a 1-year development grant the last year. And I just wanted to encourage anybody that hasn't applied before to absolutely apply. I have to say, GiveBradford and Leeds Community Foundation are one of the easiest funders I've ever worked with, and putting the application in has been so much easier than I ever anticipated. And then when we were in COVID, we had a couple of struggles because we had to change the way that we were working, and we were in receipt of the Kickstart grant, and being able to speak to a grant officer and work that through and change that around to make sure we were delivering what the community needed. Honestly, I have to really say, I've also worked with Leeds Community Foundation on other grants, and honestly, one of the easiest funders I've ever worked with. So I just wanted to kind of put that out there to encourage people to get applying for these. But my question really kind of related specifically to me, but might affect other people. So we were in receipt of the Kickstart grant for 2020 to 2021, and then this last year we've just had the 1 year development grant. We weren't able to apply for the 2 year because of having the Kickstart. So this year, do I have to apply for the Kickstart one, or can I apply for the 2 year development one because I'm only in receipt of a 1 year development one?
Yeah, I think I'm going to double check this, but I think the answer is you can apply for a development one, because if the funding has ended and the project has kind of ended and it's self-contained, then you're starting another thing. It's only when there's overlap. So for example, if it had been a 2 year, then you'd still be delivering, and therefore it wouldn't be nicely self-contained. So I think you could apply for either, and I'll double check that, and when we send out all the info, the slides and stuff, I'll make sure there's a comment in there to answer that question for definite.
Perfect. Thanks, Lydia.
So will we go to Charlotte? I think Charlotte's got her hand up.
Good morning, I'm Charlotte McEwen, Skipton Step Into Action. Lydia and Bill, you mentioned 2 levels of grants available, so the Development 2 year grant and the Kickstart grant. Skipton Step Into Action set up as a community group in March 2020, and we registered as a charity in January 2021. We've established lots of links with local social prescribing teams, GP practices, and we've run some very successful health-related projects. Could we apply for the development grant, given our setup times?
Yeah. Oh, sorry, Bill, go ahead.
I was going to say yes, Charlotte. Yeah, I think I've never met you before, Charlotte, but I've heard of the work you do, fully aware of Skipton Step Into Action, and you're quite well linked into the local social prescribers. So in many ways, you're at that stage where you probably could apply for a development grant. It's up to you. I mean, you can apply for a Kickstart and think we might do the development grant next year, but I would leave that one with you because that's your decision, but I don't think there'd be any issues around eligibility to apply for the development grant.
Thank you very much.
I've got a time bank which has been a bit dormant over COVID, and there's a huge amount of really brilliant evidence about time banking and general wellbeing, and particularly around doctor surgeries. Is the time bank the sort of thing that you'd be happy to support with this? Just a time bank person to coordinate events and raise awareness?
Yeah, we're not handing out grants today, Joe.
No,
but there's an application process there. That sounds like that could be a Kickstart application. This is an idea we have. We'd like to get this going. It might support us with some of the work we're having to do. I would say, go on the website and have a look at the form and just see how your project might fit into that. Again, it's also a chance, I think, for some of the people on the call here, when we've run this in Keighley, it's got their projects better known to social prescribers. But yeah, I don't know a huge amount about Settle and the area, but it's Townhead Surgery, I think, in Settle.
Yeah, we try, but they're a nightmare to get hold of. Jane, who's one of our directors, we've got one of our staff on the patient participation group, but communicating with them's dreadful. It's a real challenge.
I'll have a chat with Emma,
okay,
and see what we can do.
All right,
thanks.
Cheers.
Thanks, Joe. I'll go to Naz. Hi, Naz. How you doing?
Hi, Bill. Just a quick question. If we've received the grant previously, say, I mean, we didn't get the last round, but the first round that ever sort of came about, is it okay for us to reapply and do some of the work that we've already done, because we did quite a lot of, and we've got a lot of evidence on that?
I think so, Naz. Lydia, any thoughts on that?
So I think it depends when you applied for the grant. So if it was last year, when
it was the first time it came about.
2020.
Yes.
And the grant has completely finished now. So
no, it wasn't 2020. It was earlier than that. It was when the first round came in Keighley. It was the Keighley Community Health Grants. Can you remember that, Bill? First time.
I think we launched the grants in. I think we launched in January 2020.
Was it 2020?
Or maybe it was just before then.
No, yeah, you're testing 2019, and then it was
testing. Yeah, you're testing my memory now at my age.
We didn't apply last time, so no, it was 2019 when the grants the first time they came around, and then it was 2019, and then we did it. I mean, we received the grant for 2 years, but are we able to reapply?
Yes, you are.
Yeah.
I think the principle on the kind of criterion around if you've had a development grant before last year and you can't reapply for a development grant, the premise is that if you are still delivering work through a previous grant, i.e. it's not finished, then you can't apply for another development grant. But if it is finished,
no, it's finished because we handed all our reports, our evaluation, every single thing went to GiveBradford. So
Sure, great stuff.
Thank you very much, Lydia.
Nice. Go to Annie. There's a few hands up, guys. I'm just taking them as they appear on the screen, so apologies if someone's had their hand up for a while, but I'll go to Annie because she's next on the screen.
Thanks, Bill. My question was just around one of the questions on the form says something like, what will happen to the project when the fund is finished? And I think for that, we've been running it for 2 years, and we first with a kickstart, then with a 1-year development, and hopefully going to go for a 2-year development. I don't know what will happen once the fund's finished, other than we would try to apply for other funds or try and seek the holy grail of these sustainable funding pathway, perhaps through NHS. But we've been sort of saying the same thing all along. Is there some information about how we might be able to make these programs more sustainable? What are the pathways into other ways to fund it other than grant funding?
Yeah, the Bradford Health System is making an ever bigger commitment to supporting community health projects. They're really interested in the projects we've been running over the last 2 or 3 years. So I'm having conversations with how we might be able to find a process for some of the projects that have been running over the last 2 or 3 years. I mentioned that at the start about how we might be able to get them on a path to more sustainable funding. So all I can say is that we're heading in the right direction with this, Annie. And I'm pretty confident we'll get to where we want to get to. As ever with the health service, everything's just a little bit slower than we might wish for. But the progress is, for me, the progress is real. We started this as Keighley Health Grants. We're now here as Airedale, Wharfedale, Craven Health Grants. In the coming years, it might become Bradford-wide Health Grants. And part of that process is then having a journey that, projects that are working well can have into sustainable funding. So that's, and it's kind of part of that strategy of the Bradford Health System. So the landscape.
That's our mission. That's what we're working towards.
Yeah. The landscape is good, and we're going in the right direction. So we're getting there, Annie. We've chatted about this in the past, so I'm pretty confident we're getting there. But as ever, never as quickly as we would like.
Okay, thank you.
Thank you. I'll go to Lucy. I think Lucy Steer.
Thank you. Just wondered, are there any restrictions on what we can spend the money on? Can it be used for core costs? And is there any? Are there any restrictions?
Lydia, have you got a?
So it can. There's no restrictions as such. You can use a portion of your grant to cover core costs and overheads during the course of the project. So, staff time or management contribution can be part of your proposal, but I guess it is kind of project and activity focused, so not just core costs, if that makes sense.
Yeah, it's just that one of the schemes that we've just we're trialling at the moment, and we're working really closely with the social prescribers, so it would lend itself really well to this. Doesn't actually have any sort of other costs apart from staff time. So I'm just, yeah, it was really just to see if, you know, that if we could, you know, apply for this, and because as I say, there aren't really any other costs because we use volunteers. So it's just about having a coordinator to actually, you know, keep the project running.
I mean, as someone who's applied for a lot of grants in my time, Lucy, I think that's just how you present your budget. Your coordinator's working on the project for whatever portion of the time they are. In my book, that's absolutely fine. That's part of the project delivery costs. And like Lydia says, you can always have a portion set aside for, you know, a reasonable portion set aside for overheads and core costs as well. I mean, it's different. It's different for different organisations, the way they structure themselves and the way they, you know, they run their, you know, the costs that they generate. But you know, that sounds wholly reasonable to me, Lucy.
Okay, thank you.
Okay, I'll go to Majid.
Morning, guys. Hi. I'm a sport working for the NHS. I work in early intervention psychosis. I run groups that kind of help people who are in recovery from mental health related issues. So it works within the remit of the social prescribing. Question to yourself is, I work with the NHS, and however, the groups that are not supported through them, we need to require funding or get the participant to pay for it. Would I be in a position to apply for it? That's the first thing. And second thing is, like, I'm not in the boundaries of the grant. Would there be any scope in the future for this funding to come to, like, in the Bradford main area itself? Thank you.
I mean, I'll pick up the last point there, Majid, and then I'll ask Lydia about the point you made about the grant making. But the last point there is that we are chatting, you know, we've got support from Bradford District Care Trust, and we've expanded the grant area this year, and we are in discussions about how we might, you know, make that a Bradford wide offer next year. This was very much a pilot grant scheme back in sort of 2019, and we had agreement to run it for 3 years. But you know, with the independent research we've done, and the fact it's been a really good process. I think Emma mentioned that, you know, it's been a good process for grantees. But also in terms of the outcomes for patients have been quite positive as well. And this desire to invest in community health from the local health system, this is a means of making that happen. So we are hopeful that we will be making this geographically a wider offer in the forthcoming years. Lydia, I think, could you pick up the more technical point on the grant application?
So, but also just, I think I would say that if you're outside, if your project isn't supporting people from within the Airedale, Wharfedale, Craven location that is specified, then that's an essential of the fund. So just to, you know, think carefully about if the people that you're working with are in that area, because although in the future it might be different, I think at the moment that's what this fund is for. And then I guess the question about self-funded is, are you asking if it's eligible to apply for activity where people coming will pay to take part?
No, so at the moment we've got I run a couple of groups. Within those groups, obviously there's costs involved. We try to encourage the participant to pay towards the costs, but what I want to do, it's a good way of recovery for these participants. Rather than them paying for it, if we get funding, if we are successful in our bid for you guys, would you cover the costs? So for example, we might have a trainer want to come out, want to do coaching skills in terms of cricket or wellbeing skills in terms of cooking and so forth. As an NHS organisation that I work for, would you allow that kind of resources to be spent on those funds?
Yes, but so if you're an NHS organisation, I guess it depends if you're statutory or charitable. Maybe we should pick up this conversation after the call and we can go through some more specifics, just because of our kind of funding regulations around funding NHS organisations. Is that okay?
No problem, thank you.
Thanks. I think we've lost, I think you're on mute, Bill, but shall we go to Rachel?
Yes, I'm on mute, and I was saying, I'm chatting to myself there saying go to Rachel. So there we go. Yes. Go on, Rachel.
Hi, thank you. Just a quick one. Is there any stipulation around organisations' turnover to apply? Is there a maximum or minimum or?
No, that's not.
Right, thank you. That was it.
And quickly we'll go to Lisa.
Hello, everyone. My question is, as someone new to all this, although I am working in the community as well, I'm pretty sure you know my stuff. Is there like support available from a point of view of like someone I can speak to run my ideas by? I mean, there's various different things that I could like put in for. Do you know what I mean? So someone that could help me kind of figure out what's going to be the best or anything like that, some type of.
Yeah, Lisa, that's my email address is, I think, at the bottom of the application form. People can email me with if they've got some questions or some queries or they want to run some ideas past me. That's fine, Lisa. I think, you know, you've chatted to me about some ideas before as well, so absolutely fine. Okay.
Thank you.
Gemma Hobbs. Gemma. Hi, Gemma.
Hi, Bill, thanks. So the work we've done, it's been a one-year development grant. It's gone amazingly well working with people living with dementia, doing lots of creative activities. If we're to go for a 2-year from this, which I think we'd like to try for, does it need to be so an evolution of the programme? So does the programme need to change in some substantial way for it to be funded, or is it enough that it's going great, it's building, it just needs more time to build towards being sustainable in the way that Annie was talking about? Hope that makes sense.
Yeah, I think that's fine, Gemma. You know, if it's developing, it's building, it's working, then, you know, by all means, put the application in. I think that would be
Thank
fine.
you.
I don't know if I've missed anyone else's hands up. I saw Kerry's hand was up, but then it went down. Kerry, did you have a question? Or?
Hi, mine's kind of been answered a little bit by Gemma there. I think one of the things that I was thinking along the lines of is that if we apply for something, we didn't have a development grant last year, but if we apply for ongoing work that's going well, is that still attractive to the funder? I mean, what I'd say with ours is what we'll do is probably build upon the work we've done and develop it slightly. But I wanted to know whether it being new was a requirement. And just going back to Annie, I just thought as well, just trying to build everybody's confidence a bit, because we all know that being asked how is your programme sustainable in the long term is one of those questions that makes everybody sigh, because you know, sustainability is also about money, and we all know that. But you know, on a positive note, if you look at the new ICS and ICB strategies for funding and their priority areas of work, you will see what Bill said is that there is a definite shift of acknowledgement of need in the community, and therefore criteria for what they want primary care networks and other clinical settings to do is to connect with communities and is to proactively go out into community. And to achieve that, they need people like us. So, you know, I think you're right, Bill, there's a massive sea change. It will take a bit more time, but I think what's really key for us to do is look at those 4 areas of priority and constantly refer back to them and remind them what they've said in our applications and demonstrate that we're doing that. Because it's it'll be a two-way street to achieving longer term funding and getting some of the money that goes into the NHS and 1% shift work, supporting what we do and making us all sustainable, because we know we do great things.
Yeah, no, well said, Emma. Kerry, sorry. Yeah, and I saw Annie put a question, or just ICB, ICS, you know, I mean, the National Health Service, the NHS, is full of 3-letter acronyms that nobody really understands where they fit in. So I'm probably one of the few people who's, you know, over the years, because of running community projects and keen to get my projects grant funded and then commissioned, I've made a real effort to try and understand the health system. There's one thing that's true about the health system, is it keeps changing. So we're now in another process of change with new bodies coming in with new strategies. to try and link everything together. But you know, Kerry's right. You know, the basic line is, without using those, you know, ICS, IBS names, it's all about, a lot of the strategy is about trying to activate and resource the community health activity that's going on, and there's a real push to do that. You know, I've been promoting this over the last 4, 5, 6 years. It's kind of why I'm doing what I'm doing, and this is why we have this grant program, because I'm just consistently trying to prove that what you guys do has a really positive impact on people's health, and that's and if we can keep proving that, then we're getting closer and closer to having been able to get a little bit more of the resource and funding that the NHS has. So much of it spent on things like hospitals and that, but just a bit of that money getting committed on a long-term basis to community health will be incredibly important, not just for your organisations, but for the outcomes that people and patients and communities have. So that's really why we're here today, and that's why I'm really passionate about this this grant programme and what we're trying to achieve with it. So I think we're just about coming up to the end of the session. Lydia, are you going to catch up with Majid after the session, or
yeah,
do we ask Majid to stay
up.
on? So will you contact Majid separately to this? Yeah. So just from me, I'll say thanks to everyone for attending today. That's great. Go on the GiveBradford website and go to AWC Health Grants. There's a whole guidance document there that you can read through. If you have any questions or queries, contact Lydia or contact GiveBradford on their email. You can run ideas past me, and I'll give you an honest, you know, I'll always give you honest advice on what I think. Just because I think something doesn't mean that you will get funded, because the funding is a transparent, independent process when your grants go to the funding panel. But I'll always give the advice as honestly as I can, as someone with a lot of experience in running community projects and trying to get funding for them. So, you know, I kind of, you know, I totally understand where you're all coming from. Hopefully that's been clear and informative. Lydia, do you want to finish up? Thanks, everyone.
Yeah, just thank you very much for coming. We'll share all the resources that have been used so you can have access to the video recording and the slides. I'll put my email in the chat now, and that's it really. If you need any support with application forms or advice, you know where we are. So thanks very much.